So Dr Michael Klaper is an experienced physician, an international speaker, and leading advocate for the whole food plant-based diet to prevent and reverse chronic diseases. He's a prominent figure in the field of lifestyle medicine and the founder of the non-profit Moving Medicine Forward initiative, which aims to incorporate nutrition education into the medical school curriculum. So we are thrilled to be speaking with him today on the podcast. So welcome to The Nutshell, Dr. Klaper.
Well, thank you very much, Claire. I really appreciate the introduction and the opportunity to be here with you and your listeners.
It's brilliant, Dr. Klaper. We are, as Claire said, so thrilled to speak with you. But for listeners who haven't heard of you, could you tell us a bit about your journey, how you came from being a physician who I suspect was practicing conventional medicine to embracing a whole food plant-based diet?
Okay, well, fasten your seatbelts. Here are a few twists and turns. I am a classically trained physician. I graduated from the University of Illinois College of Medicine in Chicago, and I've had postgraduate training in surgery, anesthesia, orthopedics, obstetrics at the University of California, San Francisco. And for the first 10 years of my medical career, I thought I was going to be practicing blood and guts medicine in emergency rooms and operating rooms and general practice offices. That's what doctors do, I thought. But after about 10 years in practice, I got very frustrated in that my patients, despite my erstwhile efforts at telling them to take their pills to lower their blood pressure and take their insulin to lower their blood sugar, they were all getting worse. They were all getting more obese and ill. I'm getting calls from the emergency room. Joe's in with a big stroke, and Mary's in with chest pain. And my patients were getting sick and dying at an alarming rate, and I felt like a failure as a physician. And so about 10 years into my practice, I decided to leave general practice and become an anesthesiologist. And so I was 3 years into an anesthesia residency. And a couple of events happened there that really started changing my understanding of medicine and health and disease. I found myself on the cardiovascular anesthesia service that deals with people's hearts and blood vessels. And day after day, I'm putting patients to sleep. I'm watching surgeons open their chest and open their coronary arteries in their heart and pulling out this yellow guck from their artery walls called atherosclerosis. And there are already studies in the medical journals explaining that this is basically the fat and oxidized cholesterol of the animals these people are eating. It's a disease of an animal-based diet. And there are also studies showing that if one goes on a whole food plant-based diet, low in fat, these atherosclerotic deposits in the artery walls can melt away. Well, that was revolutionary, but it caught my ear because my dad died of clogged arteries. I know I've got those genes. And so it really caught my attention that I ought to be changing my diet to a more plant-based one. This was in the early 1980s. But then an event happened. I was out for dinner with another anesthesia resident and was pontificating about living a life of nonviolence. I had become quite taken with the concept of ahimsa, of going through your life causing its least amount of damage and injury to others of all types of creatures as possible. And I had read books by Gandhi and various Indian saints. And as I was pontificating about this, I was also polishing off a porterhouse steak in the local Kagan Cleaver Steakhouse. And my friend John looked at me with great compassion and said, "That's all very nice, Michael, but if you want to get the violence out of your life, you might want to start with that piece of meat on your plate, because in satisfying your desire for the taste of flesh in your mouth, you are paying for the death of the animal and for the next one in line at the slaughterhouse." Well, those words really jolted me. I spent my first 16 summers on my uncle's dairy farm. I milked cows. I loved chickens and all the animals, and I didn't want to pay for their death. So all the old rationales in my head, well, the animal's dead already, and that's what they raised them. But before I could get the words out of my lips, a little voice on my shoulder said, "He's right. He's right." And when I went up to pay for the steak dinner, I felt complicit in a crime that I had paid for the death of these magnificent animals. Well, between what I was understanding in the operating room from my left brain and what I was understanding from my heart, my right brain, that was the end of my meat eating. Well, I adopted a plant-based diet. My body loved it. Within 12 weeks, a 10-kilo spare tire of fat melted off my waist. My high blood pressure went to normal. My high cholesterol went to normal. I felt great waking up in a nice lean body every day. And suddenly the light went on. No wonder my patients were all getting fatter and sicker and clogged up and dying from what they are eating. It's the food, it's the food, it's the food. And at that point, I realized that I did not want to be an anesthesiologist any longer and literally putting people to sleep. I'd rather go back to general practice and help them wake up, right? So I did, and that was 1981. I became vegan at that point, and it's 46 years later, whatever, and I'm the happiest doctor I know. I started getting my patients on plant-based diet, found some people in the area that would give plant-based cooking lessons. And my patients experienced the same wonderful changes I did. They got leaner, their blood pressure came down, their cholesterol came down, their arteries opened up. They turned into healthy people right before my eyes. And this is so gratifying and so satisfying. I'm the happiest doctor I know because my patients get healthy. I realize that this is so profound. This is the foundation of primary care medicine. This is how to keep people healthy. And I'm thinking somebody should tell the medical students this before they get locked into this belief that drugs and surgery are the only treatment for disease. I call that pharmacosclerosis. They get this rigid belief there's a, get a diagnosis on the patient, match them up with the right drug, and you've done your job. No, doctor. Ask them what they are eating, because that's why they're sitting in front of you, overweight, diabetic, hypertensive, atherosclerotic, inflamed, from what they are running through their arteries every 4 hours. And until you deal with that, you're just going to be treating symptoms. And I think someone should tell the medical students this. And a little voice on my shoulder said, "How about you, Doc?" And so for the past 4 years, I've been going to the nation's medical schools and giving these students a lecture of what I wish I learned in medical school about nutrition, because it should be taught in all medical schools. And as the medical student goes through every clinical rotation, they should talk about how the patient's diet is affecting them. And obstetrics and pediatrics, internal medicine, they're all dealing with diet-related diseases. So we're trying to shine the nutritional light into medical education. So we're trying to create a new generation of doctors who are very aware of the fact that these major diseases are reversible. I wish someone had told me type 2 diabetes is reversible. I wish someone had told me that hypertension is reversible. I wish someone told me lupus is reversible. Well, I want to get that message out. And the key to reversing it is a whole food plant-based diet, and those two truths have to be very clearly presented to the students. So that's what we're doing through our Moving Medicine Forward initiative. And the students have been very responsive. It's so exciting to see the light go on and now I understand what I'm seeing in outpatient clinic there. So it's an exciting time, big mountain to climb, but for me at this point in my career, there's nothing else I'd rather be doing.
It sounds brilliant, and we can't wait to hear more about it. But can I go back for a second to 1981? Because I think you're right. The nutrition is becoming more aware, aren't we, of the benefits of a whole food plant-based nutrition. But back then, how were your patients responding to your suggestions? Because you were clearly ahead of the times.
Oh boy, it was a tough sell back then. It's still a tough sell, and there's no finger wagging here. I grew up eating meat and dairy like everybody else. I'm not going to be one to play holier than thou. I know what it's like to sleep that sleep where it just doesn't dawn on you what that piece of meat is on your plate, where it really came from, and what it's really doing in your arteries. We're told the opposite. You need the protein and it's good for you. Well, it's not. We are not flesh-eating apes here. We are plant-eating hominids here. It's a violation of natural law to be eating animal flesh 2-3 times a day. We're not designed for that on any level. as I said, a very tough sell back then. I started running into the books of Dr. John McDougall, Dr. Dean Ornish, and that started carrying some weight with the patients. That there are good medical studies and good reputable specialists making the same recommendations. It comes down to the art of medicine. Now, first of all, I've got a patient sitting in front of me. They've got angina pain when they walk. They're having mini strokes. Their blood vessels are clogged up. Their joints are all sore and swollen for autoimmune disease. I've got their attention. They're sitting in front of the doctor. What do I need to do to get my health back, Doc? So already the door's a little bit open into them. And I show them pictures. I turn my computer around. I show them what meat and dairy does in their diet. I show them how a plant-based diet reverses that. And the food is great. And there's no portion control. The Mother Nature, in her wisdom, made fruits and vegetables mostly out of fiber and water. That's what broccoli is, really, and that's what kale, etc. And it doesn't stick to you. The calorie density is so low. You pee out the water, you poop out the fiber. It just kind of passes on through. And so it's joyfully, if you go back for a third bowl of vegetable soup, who cares? It doesn't make any difference. And there's no calorie counting, there's no carb counting. Eat, my child. This is what food is supposed to do for you. And they really enjoy hearing that as well.
As a clinician, you're not taught that, exactly like you say, these conditions are reversible and give people the option to reverse it through their lifestyle rather than just prescribing. But it sounds like you're now going into medical schools and educating medical students right at the start of their careers. Can you tell us a bit more about that? How has that been received?
It's an interesting way you phrase the question. How has it been received? The administration of these medical schools does not want to hear this message for a number of reasons. It goes counter to their understanding of disease. It's in their heads. This is etiology unknown. It's some genetic mismatch. There's some problem in the chromosomes. They're functioning on that level. But it also threatens their practice model. I'm telling the students at the end of my lecture, here's what meat and dairy does, here's what a plant-based diet does. So how do you use this? I tell the students, when you're out in practice, find a plant-based dietitian in your state, just where she has her license. It doesn't have to be in the same city even. It works so well with telemedicine. And I tell the young medical students, practice good medicine. Take a medical history, do a physical exam, order your labs, get a diagnosis, get them on medications if you need to. But before you let that patient go and I'll say, we'll see you back here in 2 months, before you dismiss them, you give them the contact information of a plant-strong dietitian. Say, this is Mr. Jones or Ms. Smith. I want you to contact him or her. He's going to talk to you about what to eat, going to send you handouts, going to show you videos. You eat like he or she is telling you for the next month. You come back and see me in a month. Let's see if you're not leaner and healthier. And let's talk about getting you off some of those medicines that you're on. And so this is a different model of primary care practice. I mean, pull the dietitian onto your primary care team. And she needs to be introduced into your treatment program early. That's how medicine should be practiced in the 21st century. Well, that shakes up the practice model of Western medicine, where the dietitian is held very peripherally. And finally, of course, it threatens our financial model. And people really can clean out their arteries. There's going to be less bypasses done, less stents placed, less ICU beds occupied. And so the bean counter is going to see the beans flowing in a different direction. But it's too bad. I mean, that just needs to happen. So the administration doesn't want to hear this message. So we go right to the medical students. In every hospital now, almost every medical school, there's a lifestyle medicine interest group, and they're already meeting once a month to talk about lifestyle medicine. So we find out who's the head of the interest group there, and we contact her or him. And how would you like to arrange a lecture by Dr. Klaper? We'll pay for the food, get the students in the lecture hall, and let's talk about the realities of nutrition-based medicine. The more lights we can turn on there, the more nutrition-based physicians will be created.
And we hear, Dr. Klaper, that you have a book coming out on this topic. Can you tell us a bit more about this?
Indeed. I've been working, as I said, now going on 5 years of moving medicine forward. And once every few months, someone said, you ought to put this into a book. Yeah, right. I don't have time for that. But finally, a publisher approached me and provided a wonderful co-author with me, Glenn Mercer, who's a very fine writer. He's a Hollywood screenwriter, very high sense of humor. And so we both, I ground out the scientific chapters, and he and I shaped up the story of how I went from standard medicine into what we're doing now. It's really intended for medical students and doctors, and the public will learn a lot from reading it. But the chapter I'm most pleased with is chapter 6, A Day in the Disease Reversal Clinic. I practiced medicine for 35 years before anybody put those two words in the same sentence for me. But I realized that should be the standard. So I get to lean across the desk every day and ask the question that my conventionally trained colleagues never get to ask. I get to ask my patient, how would you like to reverse your diabetes? How would you like to reverse your high blood pressure? How would you like to get off those lupus medications? I get to say those words with confidence. My colleagues don't believe that these are reversible diseases. Oh, once on insulin, always on insulin. High blood pressure, they'll take these pills the rest of their life. They think these are lifetime cast-in-stone medical curses. And the truth is they aren't. They're just conditions the body generates in response to the wrong fuels, the meat and the dairy and the oils and the sugars and the processed foods that we're pouring through our tissues. That's what's generating these disease states. Well, get the proper fuel go to the body, and it's a self-correcting mechanism, and suddenly the arteries open up and the blood pressures come down and the joints stop hurting, the lungs stop wheezing, and the bowels start working, and they turn into healthy people. It's the worst kept secret in medicine, but it's one we really need to promulgate to the young doctors and to the public.
Yeah, well, we look forward to seeing the book. It's out in April, is that right?
It's out in April. It's called Moving Medicine Forward. Surprise, surprise. And that's why I was so delighted and honored to be asked to appear on this podcast, because so much of what needs to happen for society to make that turn to plant-based diets for all sorts of reasons, medical, ethical, environmental, is a matter of public education. Public awareness is so important, and that's why these podcasts are on the cutting edge of this change that must happen.
Thank you. I mean, you've been doing this for a long time now. Do you see signs that give you hope that medicine is evolving when it comes to nutrition?
Oh, absolutely. Thanks for that question. I see all sorts of signs. Back in the 1980s, if you used the V word at a restaurant, the waiter would look at you like you had 3 eyeballs there. But now there's a plant-based section on every restaurant menu, Italian or Asian, or whatever. Plant-based awareness is certainly growing on that score. Certainly in the supermarket, there's now plant-based everything. So it's much easier to be plant-based. It's much more accepted. It's hard to open a medical journal without seeing some article on a plant-based diet lowers renal disease, a plant-based diet reverses diabetes. That's starting to happen. And there are these wonderful organizations, the Plantrition Project in the United States, and the American College of Lifestyle Medicine. I go to their conferences, and you meet hundreds and hundreds of physicians and allied health professionals from around the world. The light's going on in India and Indonesia and Ireland and New Zealand. You meet these wonderful doctors that went plant-based 3 years ago, can't believe the improvements to my patients. All the medical specialties. I'm now meeting plant-based radiologists and rheumatologists and dermatologists, and they find whatever their focus is, that organ system gets better, the skin gets better, the joints get better, and it just shows, it's just the big yes that the universe is giving to humans are plant-eating creatures, and you will be rewarded with good health if we obey that natural imperative. So it's an exciting time. That said, we've all seen the meat and dairy industry become even more powerful the more meat is being produced and eaten. There's been a big anti-veg tsunami in the media, and the pendulum is swinging, at least in America, towards carnivore diets and paleo diets, and a lot of the we're seeing vegan restaurants close, and they say, "Well, it was just a fad." No, this is a marketing campaign. But I'm undaunted. The truth is the truth. They say you can't keep a hat pin in a cloth bag for very long. The point comes out. And the truth is, you keep loading your intestine up with animal flesh 2-3 times a day, month after month after year. That is a recipe for an epidemic of colon cancer and clogged arteries and autoimmune diseases and leaky guts and dementia. And the truth is going to come out like that happened. And when the journal articles start showing up, and they're due as soon, they start showing up in medical journal. Paleo diets associated with higher risk of stroke. Carnivore diets associated with higher risk of colon cancer. When these articles show up, my left eyebrow will not go up that much. Yep, that's right. That's the truth of it. And that pendulum does swing back. So the pendulum goes back and forth. The best we can do is be true to the truth as we know it here. We are life-affirming, plant-eating creatures, and the more we work to create a plant-eating society, the healthier we're all going to be.
Well, I mean, I think it's clear you certainly got no shortage of passion when you're talking about being 100% plant-based. But you, along with many other physicians who advocate a plant-based diet, will often say something like, well, if you have meat once or twice a week, that's a personal choice. That's optional. How important do you think it is for physicians to emphasize that there is this flexibility in terms of shifting people to plant-based eating? Do you think that needs to be in there?
Oh, such an important question, and my use of that phrasing is 100% in deference to the frailty of our Homo sapien brothers and sisters who are so attached to their sensuality. They like that taste of steak in their mouth. They like and plus there are deep personal and cultural issues. These are comfort foods. This is what my mother made me when I came home from school. This is what Daddy always made on Sunday nights for dinner. Always made steak, whatever. And there's these deep attachments that if I just ride roughshod over, oh, you should be 100% vegan starting tomorrow, then they're going to say, Doc, it's not for me, and you won't see them again. And so it's only because we have to recognize these deep cultural moorings that people acquire early in their life that we have to avoid being, have them throw the baby out with the bathwater, have them reject the entire concept. So it's only for that reason. And I say, well, you can have a little bit of meat once a week or twice a week, because I know that little flesh twice a week sure better than 3 times a day, like most people are eating now. And it will make a difference. It will help their body in a lot of ways. But each time I see them for their return visits, we get, how much meat are you really eating there? Anyway, you could have added seitan or tofu in there into that gravy instead. And we talk to them about ways to get that diet ever more vegan. And so in my heart, I'm a deep down ethical vegan. And I'll do whatever I can do to help the patients move in that direction without putting them off completely. But it's a delicate dance, I agree.
Yeah, it is. But with all those recipe suggestions you've got, then you're pretty well placed to get people to make those meal switches. You mentioned earlier in part of your transition to eating plant-based that you faced that challenge where somebody said to you, well, you've got a steak on your plate, so how does that correlate with your approach to non-violence? And we really wanted to ask you what you thought about how doctors can advocate for environmental or animal conscious medicine without being dismissed as being activists. Because do you think, for example, if you fully disclose that you have concerns about animal welfare, it makes people question the medicine that you're putting forward, or it gives people perhaps an excuse to question the merits of eating wholly plant-based and say, well, actually, you're coming from animal welfare point of view, and that's not something I can relate to.
Your question is very perspicacious. People don't use that word too much, but very perceptive. Absolutely, that's a nugget down at the root of the of communication about this. That's very, very important. Much to the discredit, if you will, of my colleagues, if they were really, the physician should be in a nature a seeker of truth. You see a spot on the X-ray, what is it? Okay, could be a tumor, could be an infection, could be a foreign body. It doesn't matter. What is the truth of it? That's the only thing that matters. What are we really looking at there? And we home in on that and should act on that. Well, we should be saying that about nutrition. What is the best diet? What will reverse these conditions? 100% plant-based diet? Yep, okay, that's what I'm going to recommend. That's what my colleagues should be saying. But they don't, because, and you could list the many reasons, of course, that they don't know about this, they're never taught about it. But also they haven't seen the science. Like Dr. Kim Williams, the vegan cardiologist, says, there's only two kinds of cardiologists, vegan cardiologists and those who haven't read the literature yet. And so ideally they would read the literature and jump on the vegan bandwagon, but they haven't, they don't. But they're also afraid of the being called an extremist, and having the medical boards come down on them, have their colleagues call them the nuts and berries doctor in the locker room and the hospital. There's all sorts of no, I'm not going to touch that one. And so there's a tremendous reluctance, and I have to honor that. This is where we're at. Welcome to the 21st century. This is where medicine is right now. And I get into many heated discussions with my colleagues. But it comes down, you got to pick your battle. I basically, in answer to your question, is it possible for most doctors to present the issues regarding the animals or the environment or the ethics, as you're talking about nutrition? In a word, the answer is no, it's not at this point. And I tell them don't bring those subjects up. Unless the patient asks, then by all means feel free to explore it. But you absolutely risk exactly what you just said, Claire. You risk being dismissed as an environmental extremist and an animal rights lover, and can't be a real doctor if you're espousing those beliefs. If you're talking from predetermined beliefs rather than hard science, they'll find all sorts of reasons to dismiss you. And for that reason, I don't bring the subject up unless my colleagues or the patient asks.
Yeah, it's an interesting question, though, because I think what you were saying about it's our responsibility to speak the truth. And if the evidence says eating plant-based is the best diet, then obviously that is what we should be promoting in medicine. But in some areas, we do seem to be going beyond just the individual health benefits. And there's more interest, certainly in some of the medical colleges in the UK, in actually thinking about things like planetary health, climate change, wider impacts on human health. And we do find ourselves asking sometimes whether that moral responsibility is to actually bring some of those discussions in with patients as well. And they certainly might go on if you were talking about, I don't know how things are in the US, but we're often persuading patients to take an inhaler for their asthma, which is more environmentally friendly, for example. And in that case, we're saying this is the best inhaler for the environment, and that's why we're doing it. But you don't think there's any scope for moving things in that direction when we're talking to patients about plant-based diets?
Oh, Claire, this is such a crucial point that you bring up. And I say in my lectures, as I bring up a picture of planet Earth with an increasing temperature, she's running a fever, high CO2 levels, she's in respiratory failure, she belongs in the intensive care unit. Oh, and I say, I've got a slide there, it says, it doesn't matter what your cholesterol level is if we don't have a habitable planet to live on. All this, your LDL, all stuff turns insignificant If the glaciers are melting, the ice caps are melting, the sea levels are rising, the animals are disappearing, the crops are failing, and it's because of our industrial production of animal flesh here. We absolutely, it's the question of the century facing us. And so I fully recognize the gravity of the points that you're making there, and it should be front and center. But that opens the door to such a profound issue here because of the young people. Those who are aware of the environmental peril they face. They are rightfully concerned about their ecological futures, but they haven't made the connection that burger that they love eating, that's what's driving it, son and my daughter. We got to stop eating that stuff because that's why they're cutting down the forest. That's why the rivers are drying up. That's why the soils are. It's cause of the freaking meat that we're producing and eating. It's cause of great distress, but it's a cause of great hope. If there's one thing that could really save us, or a major factor, is young people and the internet. If we get the message out to that age group that it's the meat that's killing you, it's killing your future, stop eating that stuff. Plus, you like animals, they all love animals, well, stop killing them and eating them. If we could get that message out, it would go around the world in 3 mouse clicks. And suddenly, most of the kids are not smoking cigarettes, they're not wearing fur. That's not cool, man. Well, we got to make meat eating in that same category. Still eating that stuff, don't you know what that's doing to the planet? We got to get that message out there. So yes, it is ultimately important for all our survivals. Here I am, one doc, trying to educate my colleagues who are stuck in the 1950s, thinking that they got to eat meat with protein and we got to have it. So I'm slogging away at that cold face. But you're right, the bigger issue is the future of this planet, and it's usually tied up with that plant-based diet. So who's ever beaten that drum, I'm all for them.
So you think then the planetary health messages might be more effective with the younger people, but where we're working with colleagues who maybe haven't taken on all the messages about the evidence for plant-based diets, we might be best leaving some of that aside.
So some of my colleagues that have been the most receptive are the older physicians. They've got grandchildren. And they see what's coming down the pike for them. And many of them have really gotten on board the planetary message there. So in a way, it's not all just the old folks that are to be written off. They often have the bigger picture in mind there. So everybody needs to get on this train.
Do you have any particular advice for how one can have those conversations with colleagues?
There's a wonderful little book written by my co-author, Glenn Mercer. It's a little book called Food is Climate. And it's 60 pages. You can read it in an afternoon. And he lays out the diet and meat and environmental destruction linkage there, very solid, but with very clear analogies and very light humor. But he makes it really clear. I said, please, at least read Glenn's book and let's talk about what's going on. Now, there's another colleague, Dr. Richard Oppenlander, who wrote a wonderful book called Comfortably Unaware.
That's a good title.
So it's a great title, right where the meat and dairy industries want us. So you keep eating those burgers. Don't you worry about what it's doing to the planet. You keep drinking that milk, eat those burgers. And I said, go to Dr. Oppenlander's website, go to comfortablyunaware.com and watch the videos there. Read his book by that name. At least educate yourself on the issues, because it's so important. You got kids, you got grandkids, you really need to know about this. And if it puts a little bit more conviction in their dietary advice to their patients, well, all the better to feed that fire in them.
Right, great advice. We can put links to those in the show notes.
Yes, please do.
Great. I think we've had a lot of food for thought. Thank you, Dr. Klaper. Before we say goodbye, though, can we ask you about food for dinner? Because we like asking our guests what they're having for their meal tonight.
Indeed. Well, it's so wonderful to be married to a vegan woman who cares so much about the animals and happens to be a great cook. And so I'm a big fan of Elisa's Buddha bowl. So she has wooden bowls with a layer of quinoa, my favorite grain, on the bottom there. loaded up, chops up kale and bok choy and Brussels sprouts and throws that in there. Sweet potato, puts green yellow vegetables in there, and tops it with this lovely walnut and tahini gravy over it. And I'll see you in an hour, folks. I'm a happy guy with that and some iced tea, green tea goes very well with the Buddha bowl. And when I'm a big fan of fruit for dessert, so if the mangoes are available or organic grapes, whatever, that's a great dinner for me. I'm a happy camper with something like that.
That sounds wonderful.
If a vegan meal is put in front of me, made with love, it's hard for me to turn it down. So I'm a big fan of plant-based cuisine. The taste is worth 1,000 words, and we can talk cholesterol levels all you when you put the food in their mouth. Oh, if that's vegan, I could eat that. That's not bad. Oh, tofu lasagna. Oh, I could eat that. Then you change their life with one forkful there.
We love a Buddha bowl. But do you think our husbands will describe us like that, Claire, as what did Dr. Klaper say? Our vegan wife who's also a great cook? Is that what you said? cares for the animals and is a great cook. I think.
Well, I went out for dinner last night to a friend's, and they really made a beautiful meal, and it was kind of some noodles, and it had hispy cabbage, where you roast the cabbage, and then it was with chopped cashews and a kind of miso sauce and a separate chili sauce that you put on, and it was also perfect and lovely. And these people, they're not plant-based. I mean, they eat a lot of plant-based food, but they don't do it all the time, and they'd found this beautiful recipe and made it. And I was like sort of really saying, oh my gosh, this is so gorgeous, I wish I could cook like this. And my husband said, well, your food tastes nice, but I think Matthew's got it on the presentation. And unfortunately, so much is to do with presentation, isn't it? The eye and the,
Yeah, it's true. But I can vouch for your food tasting delicious.
My food is king in the land of the blind. But Daisy's actually a very good cook. So what are you having for dinner? Can you indulge us, Dr. Klaper?
Oh, yeah. Have you got time to hear our dinner plans? No, just quickly, I will tell you, because it's a special night. It's fajita night. And we only do this when my son comes home from university because he loves fajitas. And we do tofu strips. So, instead of chicken fajitas, we'll have tofu fajitas. There'll be red peppers, red onions, lots of coriander and spices. So, yeah, it's a fun night. So we like that in this house.
Save me a place over there. Save me a plate. I'll be right over. Well, I was only half joking, actually. I'm going to be in your fair country this summer. I'm coming to the vegan camp out up in the north part of your country. So maybe we get to meet in person there.
You will. We should both be there, yeah.
For sure. Oh, that's great news. I'm so happy to hear that.
That's in Nottinghamshire.
It is. Yeah, it's just outside Nottingham.
Right, that's right here. Good. So,
that'll be an experience for you, Dr. Klaper. Going to the Midlands, which is where I'm from originally. So.
Oh, good. Looking forward to meeting all those wonderful people, especially the young people there. They give me hope, they give me energy. It'll be great to see everyone there.
Yeah, great. And listeners, you heard it here first. Come and meet Dr. Klaper in Vegan Camp Out 2026.
Indeed, absolutely. Put that in the show notes there. I'll be down there.
Fantastic. And in the meantime, if people want to connect with you or find out a bit more about your work, what's the best way?
Yes, best way, go to our website, movingmedforward.org, movingmedforward.org, and you'll see what we're doing there. How you can pre-order the book.
Fantastic. We'll put those links in the show notes again as
well. Great.
So that's been a joy to be with you and help get this word out. You guys are doing a great job, so thank you very much.
Thank you.
Thank you.